Thank you, Mr. Cliff. I don't envy anybody who has to follow Christopher in a presentation. Alrighty. So we've heard that there are issues in providing oral health services in remote, and but what strategies are available? How are we going to meet the needs of oral health? How are we going to meet the oral health needs of people living in remote? It's not really the domain, or hasn't been, of the dental workforce. There are people that go out there, but what is provided, and I don't want to be disrespectful about the people that do an amazing job in remote, myself included, but what is provided is tokenistic at best when you're comparing it to the mainstream access. So the answer to the question is, what can we do? It's difficult, it's complicated, and it's fraught with barriers. We need to change the way that oral health care is provided. We need to change the cultural we need to change the culture of oral health professionals, so we need to break down those silos. We need to be sharing skills and sharing knowledge, and we need to be broadening the scope of practice of the non-dental professionals, as well as garnering the meaningful support from oral health professionals. So currently there's the CRANAplus Clinical Procedures Manual for Remote and Rural Practice in its second edition, which is universally accepted as best practice in remote. And it includes a chapter on dental, written by Dr. Bruce Simmons at the back there, and includes management of toothache, socket hemorrhage, dressing dry sockets, dental trauma, fractures crowns, displaced loose and avulsed teeth, lancing of pointing abscess, giving local anaesthetic, blocks, infiltrations, and extraction technique. However, there's no educational preparation for this manual yet. Is that it? That's it. Yep, cool. Alrighty. So using the CRANAplus courses as discussed by Christopher, the REC, the DEC and the BEC, we could develop a dental equivalent which would include the aforementioned skills, basic oral anatomy, assessment and documentation to increase the effective and appropriate referral, as well as important advocacy and making the remote workforce aware of the burden of oral disease in remote. We all know that oral health plays an important part in general health, the links with rheumatic heart, diabetes, low birth weight, premature birth, but the remote workforce isn't there yet, and oral health needs to be incorporated into a holistic approach to patient management. So what does the evidence say? Well, I think we've heard a lot about the evidence today. I did a literature review on oral health training of non-dental professionals, and the papers identified that there was a need for both more effective referral, identifying the problems of oral health in an individual, and also training needed to provide oral health services by non-dental professionals, such as oral health promotion, screening, risk assessment, and even emergency treatment. So I think enough has been said about the dental workforce already, but this graph illustrates the inequity there in the distribution of dental professionals. And that's a nice quote to end with. Just one last thing while I've got your attention. I'll take my remote hat off and put my special needs hat on. It's today, this morning, it's been acknowledged that the value of special needs dentistry and special needs clinicians, but along with that acknowledgement, we really need the support. As Sharon Liberali will attest, the course for special needs is long, it's costly, it doesn't, and at the end of it, it doesn't have the same remuneration, financial compensation for it, whereas the other specialties do have that. But our government isn't supporting that. They've, in Victoria, DHS has removed their aged care scholarship, which would help special needs dentists get trained, and yet we have got people coming from overseas. Their governments are paying and training their are their special needs clinicians who will then be returning to their country. So I'd like members of the dental profession who have influence to bear that in mind, that there is a need for special needs everywhere, and we really need to be supporting that.